My name is Calista. I am a pelvic floor physiotherapist. Originally trained just as a physiotherapist, and then right during school and kind of near the end, I started training into pelvic floor physiotherapy. My pronouns are she, her. And the area that I mainly work in, so I probably see about 80% pelvic, about 20% like MSK, musculoskeletal conditions, shoulders, hips, knees, the rest of it. And my areas, I'm pretty specialized in what I do for pelvic health. So I've taken a lot of training specifically more into sexuality and sexual health. So I also have a postgraduate certificate in sexual health from the University of Alberta through the rehabilitation program. So I have that through them. And then also I'm currently finishing up my PhD in clinical sexology through the International Institute of Clinical Sexology in the States. So I just submitted my dissertation and I'm just waiting to get that all approved. So I also did that. How this all relates to my practice. So pelvic health physiotherapy is a very complex area of practice. I find when you first start taking courses in pelvic health, it comes across more simplified than it is. There's much more complexity as we're dealing with a very emotional part of the body, as a lot of our emotions are held in that area, and a lot of our emotions are held in our abdomen, and that's another area that I largely work. When I first started, my main kind of desire was to work a lot with patients with sexual pain, sexual dysfunction, those sorts of things. And that's kind of where my practice kind of started. And then it's just kind of extended from there. So through my work and through my PhD with the International Institute in the States, they actually were running an international transgender care therapy certification. And so I took that through them. And then I also, from there, got my transgender pelvic health certification as well. And it's not just like transgender pelvic health. So I feel like that's a piece of it, obviously post-gender reassignment surgeries, those sorts of things. But it also includes everything from top surgeries. It can include vocal cord surgeries. It can include facial reconstruction surgeries, those sorts of things. So physiotherapy can be involved in all those processes in helping to optimize function. So that's kind of where my practice kind of took a little bit of a turn, but still in the same areas. So my main areas of practice now are sexual pain and sexual dysfunction, transgender pelvic health, and then also I actually treat kids. So I also do pediatric pelvic health. And then basically I see everything pelvic health as well. So I see everything from prolapse, incontinence, pain, all the rest of it. It's not pre, postnatal, all that sort of stuff. But I definitely have some more specialized areas in my practice as well. Yeah, so to be honest, we didn't really learn a lot. I feel like I didn't graduate too long ago. I started my program, gotta be coming up on 7 years. I started now. I've been out and I've been practicing for over 3 years now. And I feel like it wasn't really a huge conversation. And I don't think that was in fault or in part to the program. I think it also was still such a new conversation. I know that it's not, and I know that a lot of this has been around for years, and a lot of this has been needed for so long. But I just feel like it wasn't something that they knew how to put into the program or knew how to address. In physiotherapy, we look at things very non-gender focused in a lot of what we do, except obviously when you get to pelvic health, it gets pretty gender focused. But a lot of what we do when you're looking at a shoulder, really in part, whether it's a female shoulder, male shoulder, or a non-binary shoulder, it's a shoulder. It's not, there's no difference there. With conditions and things, there's certain conditions that have a higher rate in, say, a male individual versus a female individual. There might be some higher rates there as conditions. And of course, you look at things like changes after menopause and stuff like that. So they really didn't expand outside of the heteronormative structure in explaining those specifics. It felt like it got more relevant as I learned more pelvic health wise, but even in that sense, it wasn't really addressed in my first pelvic health courses. It was very kind of basic heteronormative. Again, there wasn't a lot of not gender inclusivity, but not a lot of understanding or education around those areas. And again, I think it's just something that in recent years, especially in the area of pelvic health specifically, it's becoming more and more of a relevant area, and more people are practicing in that area now, and more people are gaining experience in that area. And I feel like even from a physiotherapy perspective, I think more physiotherapists are starting to become aware of their own gender biases and being aware of kind of how that plays in. I was talking to someone actually yesterday about doing this interview, and we also start talking about even like racial biases in that sense too. Like we weren't taught about racial bias in school, and I think the presumption was that we didn't have racial bias, and I think the same presumption was around gender bias, is that that wasn't something that we had. Whereas now I think more people are learning, oh, this is something that I deal with, this is something that I have, I do have gender biases, I do have racial biases that I'm unaware of, and that I need to gain awareness around and learn more about. So I think I'm hoping, I haven't looked at the curriculum for physiotherapy school now, but I'm really hoping there's more of like an education piece there in just learning gender biases and being aware of your own biases, and how we understand that. Because even in my education around sexual health, like it's very clear in sexual health training that you need to learn where your sexual boundaries are, in the sense of like where your biases lie, of like what you're okay with and what you're not okay with, from perspective of just being understanding of another individual. So there's something called in sexual health called a SAR, which is a sexual assessment re-education or something. I can't remember the right words for it, but basically what it does is it basically exposes you to a lot of different things. So it basically exposes you to like everything within, not everything within the sexual realm, but it basically helps to kind of desensitize you to things that you might hear from people, and those sorts of things. And I think it's almost like that kind of forces you to learn where your biases are sexuality wise. And I think something like that, maybe not obviously the same format because it's something different, and how you choose your sexuality, that's a little bit different than say for your gender and say your racial equality, but something of similar sorts where you're like, okay, like I really got to dive into where my biases lie. Where are my biases? What do I know? What do I not know? And where do I require to learn more and educate myself more? And I think that's even like two personal experiences as well. And I just think, hopefully, as again, those programs develop, I hope those also become a part of kind of how they're educated and how they build the curriculum. So I think the biggest thing, and you'll probably hear this through all my answers, is understanding and education. So I think for people, from the perspective of like the shame aspect, I think one, healthcare professionals, there's a lack of understanding of other people's experiences. We don't know what we haven't been taught, and we don't know what we don't know. And so from the perspective of like a healthcare professional, like you're not going to know that's potentially what someone's going to experience unless one, you either ask or you've been educated on it. And then everyone's experiences are very different. So I think there's just a lack of education for everyone across the board. I was, again, a lot of the education I've had has really helped me understand not only the perspective of someone coming into healthcare scenario and having gender biases placed on them, but also the perspective of a healthcare practitioner and dealing with gender biases, and dealing with like even the understanding of the healthcare practitioner. So I've done a couple trainings with actually two different clinics on gender inclusivity. And one of the things I talk about is our primal brain. So what does our primal brain understand versus what our prefrontal cortex understands? And it's one of those things that like they're different, and our primal brain learns basically from birth, like what the stigmas and stereotypes are. So our primal brain learns like, okay, what is a heterosexual female? What is a heterosexual male? Like, what are those structures? We learn the heteronormative style of society, and we don't really learn the other parts. We don't learn we're not raised from birth to understand those other pieces. And that's just because that's our primal brain, that's our primal understanding of everything. And then when it comes to like our prefrontal cortex, that's where we learn and gain knowledge and understanding. And it's important to like educate our prefrontal cortex so our primal brain can be educated as well. So when, say you're walking down the street, or say I'm sitting in clinic and someone comes in and they're not dressed how like my like primal brain thinks like a male should be dressed or like a female should be dressed. For me, I have that prefrontal cortex knowledge now that like that's so okay and that's so wonderful and that's awesome. And everyone can do what they want in that sense, like totally fine. Whereas like if you don't have that understanding, it's like your like primal brain's like, whoa, like something's not right. Like I'm not understanding, like I don't know what's going on. And it's almost like our primal brain puts up a little bit of a guard and is like, whoa, like stop, like, and puts up a little bit of a defense because we don't understand. But then as soon as like you talk to the person, you figure out kind of what their gender identity is, how they self-express, all those sorts of things, then you can be like, okay, like this makes sense again and I'm fine. And it's not like, and so it's that thing where like we also, it's important in those experiences to also learn like not only what the person themselves is experiencing in shame and stigma within the healthcare system, but also as healthcare practitioners, what are we experiencing? Why are we experiencing it? And how do we change that? And I think it's about really addressing both at the same time. And I think that's how a lot of times it's played out, is that we are expected to know everything. We're expected to know and understand all of it when you can't. There's too much to understand. There's too much to know to really understand it all. That's not an excuse for healthcare practitioners not to know and not to educate themselves. But it's that thing of like, it's important to know that like, okay, it's okay, you're gonna make mistakes and that's okay. And it's knowing when to say, I'm sorry. It's knowing when to say, okay, I need to learn more about this. Because again, yeah, that expectation of like, you should know this stuff already, you should understand this stuff. And then it's that thing of like, okay, yes, but also you've got to figure out where that bias lies and then educate yourself, because it's impacting others, not just yourself. And it's impacting individuals, because if you're not willing to step out of that understanding, not willing to explore that and learn more about the gender biases that you hold, or even learn more about someone else's experiences in healthcare, I think that's when the debate lies of like, well, we're healthcare practitioners. We have to reach out. Like that's part of our job, and it's necessary to be able to understand other people's experiences. So I think one is lack of education. So just not, and like I said, I was going to emphasize that quite a bit, but lack of education, I think, is a big thing. So just not understanding, not being aware. So how to ask the right questions, how do you approach the subject? I think a lot of times, again, primal brain is like, okay, like I don't understand this, like what do I do? And then like the response is, okay, run away. Like I don't understand this, I don't know how to address this, so I'm either gonna like run away from it, or I'm just gonna pretend that it's not a thing. So I think the lack of, just how to deal with those scenarios, how to deal with your own gender biases again, and how to deal with those scenarios in an appropriate and professional way, and as well as an inclusive way. I think that's the biggest thing from healthcare practitioners, just lack of understanding. And then fear. I think that applies to both. I think fear from a practitioner standpoint of, you don't want to get it wrong. Like, what if I got it wrong? Like, what if I messed up? What happened? It's fear of, okay, is that person going to never want to come back to see me? Am I going to hurt their feelings? Am I going to put my foot in my mouth? Like, is this going to become an issue? If I don't it's like, you don't know. So it's like, you can kind of ignore it if you don't know it, but it's that thing where you can't ignore this. You can't just not know. This is something that is so important. So I think it's also that, like, that fear component of like not wanting to mess up and not knowing what to say, and being scared of hurting someone's feelings. And I think in that sense, like, I think everyone needs to know we're all understanding about that. Like, I think there's a general, like, it's okay. Like, anything that I've heard from anyone in the LGBTQ plus community is, you know what, like, yes, we want you to educate yourselves, but if you mess up, like, we understand, just say you're sorry and we'll move on. And that's kind of been all my training. It's literally just like, if you're going to make a mistake at some point, it's not okay to make mistakes, but it's okay to make mistakes. Like, just say you're sorry and we'll move on. So I think in a big side of things, it's just fear coming from the practitioner. And again, it's that fear even from that primal brain being like, I don't know how to handle this. I don't want to deal with this. This is going to be really hard. I don't really know where to go from here. So I think that's from a practitioner standpoint, but then also from, I think it's similar from the patient's perspective of, again, fear of how they'll be perceived and how they'll be accepted. So in the sense of like, do you tell your story? Do you tell who you are? Do you explain that to a practitioner? Or do you just pretend you fit into the heteronormative mold to just not have to deal with it, right? Like, it's that thing of like, do you just kind of like accept it and like not worry about it out of like fear that it's not going to be accepted and maybe that your care is going to change or something like that. And it's a matter of, again, okay, they're not going to understand me, so I'm not going to share my story, and I'm just going to pretend I fit into the mold just to get through this experience. And I know there's some people who have done that before just because they're out of fear of what the experience is going to be like, out of fear of not having a practitioner that's aware of their experiences and aware of what's going on for them. And so I think that for a lot of people, I think it's that fear component in a sense. And then just like not understanding, and I'm sure you've heard like stories of people who've had like terrible experiences within the healthcare system in that regards. And I think it's really important that we, again, educate ourselves and that it's something that isn't tiptoed around, that isn't, okay, you got to be really cautious around this. You have to like tiptoe around this. I think it's something that's like, no, we all need to educate ourselves. We need to educate the general public. We need to educate ourselves as practitioners so that we can ask the questions. We can ask, what are your pronouns? We can ask, how do you identify, without fear of the answer. And for everyone to be able to be who they truly are and express themselves and be able to express that to their practitioner without thinking that their care is going to change in any way. Big one for me is inclusivity. So I really want everyone to feel included, no matter where you come from, no matter what your background is, no matter what you believe, you are welcome. So I always want to make sure that everyone feels loved and cared for, and like that, yeah, when they walk through my doors, they're inclusive. And I don't know if there's like specific things necessarily that I do. I know there are, and I'll share some of the very specific ones. But honestly, it's just a very like non-judgmental approach to how I do things. I'm very, if you're uncomfortable with anything, you let me know. Like, I want you to be 100% comfortable in this room. Whatever comes up, you let me know. I always say, like, when I'm asking questions, because in pelvic there are a lot of questions and there's a lot of kind of really personal ones. And so I always share that if I ask any questions that someone doesn't want to answer, they can say pass and move on, and that's okay. And I just want to, so for me, it's a lot of like, you get to share what you want to share. You get to tell me your story. If that includes pieces of kind of from a gender bias perspective, from a shame perspective, fine. If it includes like, if it's more other stuff that you're dealing with, that's okay. My door is closed, but like, it's an open room and you can openly share, and I'm never going to judge in what your experiences are. I'm going to address things that I need to address, but if there's things that aren't relevant to what we're doing, in the sense of like, you sharing with me who you are and your gender identity is most likely not really like, it's relevant in who you are, but it's not going to change how I'm going to treat you. I'm going to still treat you with the same respect and care that I treat just anyone else, regardless of your gender identity. And so for me, it's very much like that doesn't faze me as much anymore. I feel like I've kind of developed that thing of, you are who you are, and that's cool in my practice. I specifically, like, I always, on all my like emails and everything, my email sign off has my pronouns on it. So anyone who gets my emails know that's on there. On the website, on our website for the clinic, my pronouns are right beside my name. So those are just some like really simple ways that I've like integrated that, just so people are aware. On my same thing on my, even on my Instagram, as you've seen, like, yep, my pronouns are there. I also list like that I am a practitioner in transgender pelvic health as well, so that's on there. And that I found has been kind of the biggest thing with people coming to see me and kind of being aware that I am more open and inclusive, is that like they see, oh, they've got training in this probably means they are more aware of things, they probably are more inclusive of things, more inclusive of the LGBTQ community. And I would definitely agree, and that kind of is one of those things that stands out a little bit more. But yeah, I always tell people, like, you are welcome, you are going to be cared for no matter who you are. You should feel safe in this space, regardless what we're doing, regardless what we're treating. And again, that's another thing. Even if I'm seeing someone for like a shoulder, a knee, a hip, whatever it is, even if it's not pelvic, it's that thing of like, you need to feel 100% comfortable the whole time. And if there's any point that you don't, you need to let me know right away and we stop what we're doing. And it's just being and letting people know that. And then I'm not afraid to say I'm sorry, or I'm not afraid to say I don't know. When people ask me questions, I think that's another, and probably is a barrier in just general as well, for, and this jumps back to the last question a little bit, is that like saying you're sorry and saying you don't know are really hard as practitioners, because you don't know what that's going to mean for you. It's this thing of like, oh, don't, like, try not to say you're sorry, try not to screw up. And it's like, we're human though, like we're going to at times. Obviously don't screw up in big ways, but it's one of those things of like, you just say you're sorry, realize that you did something wrong, admit that. Or if you're in a scenario where you don't know the answer to something, be willing to say I don't know, and be like, you know what, I'm going to look into that more for you, or else I'm going to seek out a practitioner that understands that. That's okay. And I feel like that's another way for me, is like, if someone asks me a question I don't know the answer to, I'm always willing to be like, you know what, I don't know the answer, but I'm going to go look it up for you and I'm going to find out that answer, because I think that's important. And if I don't know it and I think you need to see someone else, or I think you need to go back to your doctor, or whatever the answer is, then I will tell you that. And I'm not gonna admit that I know everything, because I definitely don't. So those are kind of like the biggest things. And I think, and it's a slow process for me as well. I'm not perfect in these areas, as I've already admitted a few times. It's definitely something that like is an ever growing and ever learning how to like address everything in one scenario. It's a constant conversation with fellow practitioners. It's a constant conversation with different communities of figuring out how is the best way to approach these conversations. How is it the best way to kind of talk about pronouns and not make it like awkward for people who maybe don't understand pronouns, but also like we need to be inclusive of everyone. So it's that kind of thing where like it's a continuous conversation of like, okay, what should I add? What do I need to take away? What do I need to change in how I practice to build that inclusivity, to break down those biases, break down those stigmas, and really kind of make everyone feel welcome, while acknowledging everyone's different identities. That even just little things like that can definitely make someone feel more inclusive. Obviously, there needs to be more than just that, but that can be that first open door that's like, okay, this person's aware of this person has knowledge here of some sort. I'm going to explore what they do more. Yeah, I would say, again, education is a huge one. So if you don't know, look it up. So if you're not aware, I definitely always recommend like get yourself educated. I think that's the number one thing you have to do, is understanding kind of, and then understanding where your biases are. So like, I can't think of any good resources off the top of my head right now, but even just like sitting down and being like, okay, do I have biases in this area? Do I have gender bias? Do I get scared or worried if someone who doesn't follow under the heteronormative type of lifestyle, do I get nervous to have conversations with them? Do I know how to have a conversation about their lifestyle without asking too many questions, or without some sort of stereotypical response, right? So I think it's understanding where you're at, and then also then educating yourself and knowing that, again, you're not going to be perfect. I think, again, this is something I've learned even from the racial bias perspective, is that thing of we don't fully understand, but yet we do have a racial bias, we do have a gender bias. Like, that is true. Like, that is true in how we're raised, how our primal brain understands things. There's a bias there, and it's about being willing to admit, you know what, you're right, that is there. Okay, how can I educate myself so that my prefrontal cortex understands it more, and that can change how I respond. And I think that's, again, I've reiterated a bunch of times, that's kind of the basic step. And if you don't know how to get education and you don't know where to look, ask. So reaching out to people like yourself, Caitlin, so someone who does understand this a little bit more, is doing more research on the area, things like these YouTube videos to help understand where some of this is at, and then looking up programs, looking up books that are going to help you understand more. I think that's really, really important. There's so many people on social media and all those sorts of things that are sharing more and more about their educational resources that they've read, or those sorts of things to kind of help with that. So there's always resources out there to look up. And I would just say the biggest thing is education. And if the other thing I always tell people if I'm doing a gender inclusivity training is, if you can't do it, if you feel like you are, you know what, it's, my line is here and I just can't, then admit that. Admit that you can't. Admit that you don't think that you can try, and obviously still care, respect, all those sorts of things are number one. But if you feel like as a practitioner that you know what, I would love to be able to do this, but honestly, it's not something I fully understand. And if you think that what you're going to do is actually going to be more harm than good because you can't understand it and it's hard for you to understand, then admit that and refer that person to someone else, or admit it and then let your administrative staff or whoever takes care of your bookings know that that's a type of patient you can't see just because it's not something that you feel comfortable with. And so I'd say that's the other biggest thing, is being okay to just say, you know what, I'm not comfortable treating this area. I think this needs to be treated by someone else, and then give that person someone to see. I always tell people it's never wrong to admit that you can't do it, and recognizing when you are at your line of you're like, I just can't understand, then that's at your point. And you know what, that's okay. Make sure though that that person has someone else to see. Make sure that there are resources there still for those individuals, and make sure that you have an idea of who they could see instead if you yourself feel you can't. Because if you push yourself to see someone and you're not comfortable and you're not willing to understand, or you're having struggling to understand and just it's not within your capacity, then it's just being like, okay, you know what, like I've reached my comfort level. I can't go any further than this, but I know there's practitioners out there who work really well in this area, and I think there'd be someone else better for you to see. And so I think, it's both a piece of like education, but then also admitting when you're outside of your comfort zone and you can't anymore.